But ultimately, like Carol shared, Fletcher and I are both from the board of directors of Planned Parenthood Columbia Willamette, and we'll kind of share what our geographic area is, what we do. But I also want to preface that we are not the incredible, dedicated staff that do this work each and every day. We're really honored to be here. But as you can imagine, the staff are pretty incredibly busy under normal circumstances, and then add kind of this new climate that we're in, adding the big influx of clients that we're seeing come to Planned Parenthood in Oregon, and of course navigating this political climate. So we were happy to step in, we're happy to answer your questions, but know that we're board members and not, trained staff here. Ultimately, though, I was really happy when I was asked to join Planned Parenthood's board. Like Carol shared, I have spent my entire career dedicated to nonprofit work. I started with kids down in Texas. I kind of started working for the Red Cross. I bumped up and down around the United States, and then came here to Bend, because who doesn't want to live in Bend and raise your family in Bend? And I came here to lead Saving Grace, which is the domestic violence and sexual assault provider. If you don't know this, there's a big overlap between domestic violence, sexual violence, and access to reproductive rights. Oftentimes people are controlled, they're not able to have access, and that's where I was asked to come onto the Planned Parenthood board to kind of have that expertise. Fast forward past COVID, and where we are now, and I've stepped into this role at Deschutes Children's Foundation, which was an honor for me because I get to support 23 different nonprofit partners that serve kids and families here in Central Oregon. But the fact of the matter is, vulnerable populations, vulnerable families that are just at the basis of ends meet, need access to services at Planned Parenthood. It's a big place of connection, whether it be general, OB care, family planning care, transgender care. There's so much more that Planned Parenthood does. So ultimately, I was honored to be asked, and I'm honored to continue to advocate for Planned Parenthood because I feel like our mission is more important now than ever.
I guess is this one still on too? Good. I had a fairly lengthy career in Portland doing financial things, treasury, and what's called investor relations, which means I lived and died with PowerPoint presentations to investors. But I retired more than 10 years ago. So actually, as I was realizing I was going to come do this, boy, I haven't done a PowerPoint for a long time. Just before I retired, I lived in Portland. I got a call from a colleague from a prior company, a woman who I had huge respect for, and she'd invited me to the annual luncheon that Planned Parenthood does in Portland every year a number of times. And so I was a supporter, but not huge in it. But Julia called and said, we're looking for somebody from Bend. By then I was married to a woman who was living in Bend, and I was going to live here. They also wanted somebody on the finance committee, and I had financial background. So I spent 6 years, 2-3-year terms, sort of standard stuff. I think I was a reasonably energetic and active board member, and they asked me to stay on the finance committee. So I did that for 3 years, and then to my surprise, there were some changes that meant one of our other colleagues, who's currently the chair, called up and said, we didn't add new board members for a while. I've come back as board chair. This is Sally Brown, who's the current chair. And I need to rebuild the board. Would you come back? And I was informed by my wife that I was too busy and not getting enough done around the house and things like that. But I also realized that at my age, I was being offered a chance to be a small soldier on the good guy side of the culture wars, and what I considered the good guy side. So I decided to say yes, and I have been more energized and more fired up about supporting this organization than ever. And just before I went back on the board, we hired our prior CEO, who was great, and Udall had retired, and we just hired a new CEO whose name is Sarah Kennedy. She actually spoke here at the church in January. She is dynamite, and it has just increased my energy and focus on this is an organization I really want to do everything I can to help. So we have a presentation. I think we'll probably go through the slides. I won't read every slide, I promise, every word. And then and questions if you have questions, when I want to interrupt, please do so, but otherwise we'll do questions at the end. We can talk about what we know about the current reproductive healthcare world in Oregon and across the country, as much as we can offer. So I'll jump into the presentation. Quick distinction. We're on the board of Planned Parenthood Columbia Willamette. Planned Parenthood, like the Red Cross, is an affiliate organization. There are 40-some affiliates, or they say 49. There have been mergers, so I thought the number was shrinking. 49 affiliates around the country who actually deliver the health care. So Planned Parenthood Federation of America does legal work and provides some services to each of the affiliates, but it's the individual affiliates, which are individual 501c3s, that actually deliver the healthcare. PPCW, as we call it, Planned Parenthood Columbia Willamette. I'll show you in a moment. It includes Ben, even though it says Columbia Willamette, and is the only statewide sexual and reproductive healthcare provider in Oregon. And we take care of anybody who walks in the door, no matter what. Our tagline is care, no matter what.
Well, and Fletcher, that was actually a really relevant thing for me as a young teenager. I was 18 years old when I became a client of Planned Parenthood. My family was just fine. I was not in a low economic status, but I was terrified that my parents might find out that I wanted birth control. So I walked into a Planned Parenthood door. They asked, do you have insurance? I said, absolutely I do, and I would not like to use it today. And they said, that is just fine. Come on in. What do you need? Can we talk? And so I think it's a really important distinction. So many folks come to us for so many different reasons, and their need to walk in that door can be so different. And we serve them regardless of where they're at and make sure they have the care that they need.
And you can see on this map, PPCW has 9 health centers. Actually, 2 of them are located in the same spot near the headquarters in Northeast Portland. There's a reproductive health care center, but there's also a specialty surgical center there. But we include Vancouver, other areas around Portland, Salem, the Bend clinic, which opened 20 years ago, something like that, more than 20, at least 20 years ago. And then I'll get to that in just a moment. Good question. Excellent question. But the interesting one right now is Ontario on the right. We opened that clinic in 2023. I think it was April of 2023. It took about a year of planning. It came after Roe v. Wade died, after the Dobbs decision. And it was a very gutsy move for the organization to do. Ontario is obviously right on the Idaho border. And it's new, it's full. We honestly have a little bit of trouble holding on to clinicians because most of them are coming from Idaho and driving across the border to serve patients. And it's an exhausting process. But we're doing some things within the organization to increase the capacity of the Ontario facility. It's also the place where right now where we have the most protests. There's a separate Planned Parenthood Southern Oregon, another affiliate that is based in Eugene and has clinics in Eugene and 2 more in the southern part of the valley. It's significantly smaller than we are. We work together with them as much as possible, and Sarah and Amy Handler, who's the CEO, a relatively new CEO there too, are joined at the hip at this point in terms of the work they've been doing. I'll be honest, off and on over the years, there's been talk about should we merge or not, and for different reasons, different times, they've chosen not to do that. There have been a number of mergers of Planned Parenthood affiliates around the country over the last few years. That may change here. Right now, we're working together as a statewide organization.
What was the name of the organization?
PPSO, Planned Parenthood, Southern Oregon.
It is called Planned Parenthood.
It
Yep.
is, yeah.
It's just another one of those 49 affiliates. They just have a slightly different regional geography. But like Fletcher said, we collaborate, we talk, we strategize. We both utilize the same Planned Parenthood Action Organization. So that's our C4, and I'll talk a little bit more about that later. But one thing that I like to remind folks anytime we're looking at a map is, I shared I started as a client when I was 18. I'm still a Planned Parenthood client today because for a couple of reasons. One, we all know kind of the healthcare desert that exists here in Central Oregon. It's not always easy to establish care with a PCP or with an OBGYN, but it's actually really beneficial to Planned Parenthood when folks do come in who have insurance, who can pay to both be on the schedule, to have kind of a different model. And I've gotten some of the most exceptional OBGYN care that I've ever received in my life from Planned Parenthood. So I highly recommend if you have yourself you need care, if you have daughters who need care, it's a place where you can get in. You can get an IUD, you can get birth control, you can talk about whatever kind of menopause pieces you want to talk about being, reproductive health care. But despite your income, it's really beneficial to still be a client of Planned Parenthood even today.
Do they not have anything up by Hood River? I mean, is this all that they have in the?
Right now, this is it. Depending on how the next year or so goes, part of Sarah's initiative coming in has been to talk about, actually, you can see LaGrange is up there, folded out or faded out. One of the things we're going to do is look forward and say, where else should we be? Where is it cost effective? And what's the right place? Whether Hood River, the Dalles, LaGrange, Baker City. We actually have a board member now from Baker City. So I'll be honest, the organization historically had a very Portland-centric focus, and that's changed. And this is a statewide organization now. So there are financial issues as to how much we can afford to go. Question over
So
there?
does that second organization serve Southern Oregon then?
Yes,
Okay.
yes. So they have clinic in
So-
Eugene, Roseburg, and maybe it's either Roseburg or Grants Pass. The only meetings I've been to with them, frankly, are in Eugene, so I'm not exactly sure. They're quite a bit smaller, and that also has financial implications as to what happens long term. But that's to come. But again, we're joined at the hip right now. And Cassie mentioned a range of services. This is one of the slides where I'm not going to read any line for you. But there are a couple of slides here, and I think it's interesting that there are two slides and they are this long, for all the different types of healthcare that we provide. This one focuses particularly on early pregnancy and abortion care. And you can see details of the difference between medication and procedural abortions, as well as a range of other pregnancy management issues. In addition to specifically pregnant related, there's also a much wider list of preventive and reproductive health care services that we provide. We are the largest provider of STI, STD screening and treatment provider in the state of Oregon. We provide gender affirming care. We do HPV vaccines. We do vasectomies. It's a remarkably wide range of services, and wider than I think most people do, and certainly wider than most of the public understands of what we do.
You use local professional people to provide the services on it?
Yes, and they're all, in Bend, for example, yes, they all live here or in the area. Most of our full-time providers are LPNs or anyway, senior nursing capable. We do nurse practitioners. That was a phrase actually. We have a medical director based in Portland, and we have doctors who provide some services part-time. The full-time staff is clinical staff, mostly nurses and nurse practitioners here.
One thing that was really exciting about our new CEO, Dr. Sarah Kennedy, is she is an OBGYN herself. So it's pretty incredible to have a leader who not only has been in the Planned Parenthood climate, she actually came to us from Planned Parenthood in California, but she's also a provider and is in the clinic with our clinicians, is able to provide services and really have a firsthand approach about where we need to go and what we need to be.
So, new CEO in this crazy political environment, getting to know her organization. She started in April last year. She's already got her Oregon medical license. I know she doesn't have a lot of time to work in the clinics, but that's her. She was doing that at Planned Parenthood, Northern California, and her intention is to at least do some time in the clinics on a regular basis. It's amazing. I don't know how I don't think she sleeps. This is a list, again, I won't read everything, but I think it's a fascinating list of the number of different services. And again, I said we're the largest STI test provider in the state, contraceptive cycles, emergency contraception. You'll see that the two at the bottom are abortion related. Everybody thinks that Planned Parenthood is abortion related. 13% of what we do is abortion related. And you can also see the majority of abortions are medication abortions, but there are some surgical procedure abortions. But 87% of what we do is not abortion related. So we're throwing lots of numbers up, a lot of data at you. If you remember, there are two numbers that I'd like you to remember. The first one is 13% of what we do is abortion related. 87% is not abortion related. The world doesn't know that, and people who are anti-Planned Parenthood have no idea what they would be missing. You know.
Is that a national percentage?
It's actually higher for us because it's legal in Oregon. If you added it up, I think it's around 7%, because a number of affiliates that are struggling but still surviving in places like Texas aren't providing abortions at all. The number used to be 7 that I had in my head for a long time. So 13 is actually higher for us, and that's in part because people are traveling here.
I was just thinking that if only 13% is abortion related, and that's not the idea that the public has, perception, there's a little bit of PR.
Mm-hmm.
I know you guys are busy and you don't need another job, but just an idea.
It's part of why to do this conversation and to have more of those, just to keep spreading the word.
Yeah.
And, people have made that point to members of Congress or state legislatures, the people who are upset don't pay any attention.
I understand.
A big part of our work, we do have obviously our clinicians and our clinics. A big part of what Planned Parenthood does as well is providing education, is in the high schools, and so I would venture to say that our Gen Z and our youth are far more accustomed to what we do and reaching those services. And yeah, to your point, it's about making sure that we share that message, that we change that rhetoric, because really when you look at Planned Parenthood as a health center, and again, a place here like Central Oregon, where we really have some discrepancies in the amount of clinicians and healthcare that we have to the population that has grown, it's pretty vital that we continue to exist, not just for abortion, but for everything else that we do and provide to the community.
How many men do you see?
Ooh,
The percentage is 14.
How do you know?
So the 14% male is not the other number I wanted you to remember as we throw lots at you.
I have a grandson, that's why I'm asking.
Okay, that's great. The number that's key to me on this one and is very key to our future is down here at the third bound. But first of all, let's 86% are aged 15 to 40. That makes sense. I was actually surprised at the 14% male. That's high, although there is 5% that chose not to answer. A significant portion is BIPOC. But the other number that's really key for us right now in this environment is that 69% of our patients are on the Oregon Health Plan, which is Medicaid. Oregon Health Plan is the Oregon vehicle for that.
Are you seeing increasing numbers of men?
Somewhat increasing. The vasectomy services are relatively new, so yes, it's been going up. But I don't think it's I don't think it's been changing a great deal. So, but the key number again here, two numbers, 13% abortion, 69% of our patients last year were Medicaid related. So when you hear noise in Congress talking about messing with Medicaid, that is absolutely crucial to us. And it's part of our care no matter what. People, we're going to take care of whoever shows up. But a lot of it has to go through Medicaid. Yes?
As Advantage plans, do you, as covered with, for?
Private, the other 31% is a combination of self-pay and private insurance. So yes.
Advantage, like, Pacific Source?
Yeah, if people have that, I mean, we ask, do you have insurance? Do you want to use it?
I use my Pacific Source just.
So you're on the list.
Oh, yeah.
Yeah,
No,
but
most insurances you can utilize at Planned Parenthood. And again, like I shared, it's a great way to kind of throw your healthcare dollars into a place where it can really matter. Even though most of our patients are Medicaid related, and yes, we get reimbursements for Medicaid, I think it's really important to know that Planned Parenthoods operate on a deficit model, right? As long as we accept Medicaid, which we always will, it will always cost us more to provide these services than the reimbursement rates that we do, which is why we have fundraisers and grants and, a whole team dedicated to make this up. But the fact of the matter is, even under a really friendly administration, maybe even in a state, Oregon doesn't have the best reimbursement rates in the country. We love Oregon. There's a lot of great things about our access to healthcare and reproductive rights in Oregon, but actually our reimbursement rates are pretty low. That being said, we rely on that to just be in this deficit model that's sustainable for us. If we really see Medicaid change, which we all know is highly likely, it's going to be devastating to many Planned Parenthoods across the country. Luckily, PPCW is one of kind of in the top tier of Planned Parenthoods, both financially, both clinically, both operationally. But again, we operate at a deficit with Medicaid, and that will only get worse if Medicaid goes away.
So what other agency, what other nonprofits that serve the low income with Medicaid besides Mosaic, which would affect them too?
yes, Mosaic and Volunteers in Medicine, although many of them aren't even Medicaid, many of their services.
But do you work together with them, or how does that?
We try to coordinate in terms of the political, and actually I think the next slide is all yours. The whole political effort of being in Salem to get reimbursement rates, being in Washington, which PPFA also helps us with, to basically lobby for improved funding and improved reimbursement rates. I guess the other point on this that I want to make too, that you may have heard over the years, people talk about defund Planned Parenthood. The implication of that is that there is some sort of federal grant to Planned Parenthood that you could just stop. No, it's all Medicaid money. It's reimbursement for providing healthcare services. And anything short of that would be, or anything beyond that, you would be singling out a single provider within Medicaid. It could happen, but we don't know it, not so far.
I joined Planned Parenthood long before I moved to Oregon, and so I joined the National Planned Parenthood. Now I want to know where's the best bang for my buck? Is it go to National?
Oh, I'm so glad you asked. We're going to talk about this twice.
We agreed to split the slides, and I think Cassie's slides are starting next, and we'll answer that question.
Well, wait, before you go, Fletcher, and I'm going to hold on to your question, I do think it's really important to know that we've had patients from all 50 states here in Oregon. all 50 states. And another really important number for you to know, but we'll talk about this more at the end. So yes, we're part of a national organization, Planned Parenthood Federation of America. They do amazing work. They provide a lot of infrastructure to our various affiliates across the country. However, if you're wanting to donate, if you're wanting to support, I highly recommend that you give locally. That is what goes into our clinics. That is what funds reproductive health care right here. A lot of what the National Federation is doing is providing that support network. And they're also having their own set of challenges between various lawsuits that are going on, various pieces. So if you want to support, I might come back on in just a second. If you want to support, give locally and give locally to PPCW because that's what comes right here in Bend.
Because they do say that they do to give it to individuals.
We get a very small percentage, a very small percentage. And that is true for any affiliate model. It was true when I was at the Red Cross. You donate nationally, they look at the zip codes and they give you about 13%. So know if you're donating nationally, most of it stays at the national level, very little will trickle down to Oregon.
That's also true for the League of Women Voters, so give locally.
And don't worry, I'm gonna tell you how you can give locally later in the presentation.
We
So-
agreed to split the slides here.
Well, chime in, because goodness knows I chimed in with you. Like I shared, though, we're so much more than just clinical services. We provide pretty vital education here in Oregon. We served over 12,000 middle school, high school, and college students. That's inclusive, comprehensive sexual education. I know it shouldn't be a surprise, but the fact of the matter is we don't always teach this in school. Teachers either don't have time, they don't have the proper curriculum, the resources, and so that's a big place where Planned Parenthood can come in, especially in our more rural outlying areas to provide those services. And then across Oregon and Southwest Washington, we provided more than 14,000 people with outreach efforts. And again, kind of to your point of sharing our mission, sharing that story, making sure people know what our services are, knowing that it's so much more than abortion, and knowing how they can access them is something that our team is doing all the time.
How do you do the education part? Do you go into the schools or, my grandson's not gonna show up at a Planned Parenthood meeting just to learn about
It
sex.
depends on the school district. And Ben Lapine has not been receptive.
Yeah, not surprising.
And but Redmond is, for example. And so some of that variation is also true around the Portland area. There's a woman named Liliana Cabrera who's been running the education program here in Central Oregon for 5-6 years now. And that has now expanded further out into Eastern Oregon. So she's got a number of contacts in different school districts out from here and east. We haven't given up on Ben Lapine, but they got their own issues, so they've chosen not to. But we actually do classes in there. We also have teen challenge programs. There are a number of out of school programs that we also run that the kids know about and can get to.
I just was curious, I guess it's one slide back, out of the 13% of your abortion services, does Medicaid cover any of that? I'm
None.
just curious, just so you know,
Yeah,
talking
the Hyde,
points.
yeah, that would be clear. That's the Hyde Amendment was passed a number of years ago. There are 0 federal dollars that are used to fund abortion. And we have very careful systems and programs to make sure that there is no federal money going to provide that. Oregon happens to, and a couple of years ago, they changed the reimbursement rates. The state of Oregon has been very positive and generous. So their overall Medicaid reimbursement rates are middling in the country. Their reimbursement rates for abortion services cover our costs. So they've been, the legislature and the governor have been extremely supportive for us on that. But it's all state. There is no federal money, and I should have mentioned that earlier.
Is emergency contraception included as an abortion under the Hyde Amendment, or is that?
Not that I'm aware of. I don't think so.
So that.
Yeah, there has been, and again, we'll kind of highly talk about some of the threats, and we'll talk a little bit about what's coming forward in 2025. But there are a couple of big considerations that Planned Parenthoods across the country are facing. I did hear somebody say like Medicaid's not going away. I agree. I don't think it's going to go away completely. There's been a lot of conversation at the federal level about changing how Medicaid dollars that don't touch abortion can be used when somebody is getting abortion services. So again, if you're getting billed, you walk into a clinic, you're not just getting an abortion, right? You're getting STI testing with that. You're getting family planning. You're getting all of these other services on top of it. So Planned Parenthood affiliates are doing some planning. Okay, what if there's a federal mandate that no Medicaid can be used if it's at an abortion service or with an abortion service, what that could mean. Also, there's a lot of conversation about what is considered abortion. There has been some conversation at the federal level about is an IUD an abortion tool. I know it's wild. It's wild. I still chose to get mine the day before President Trump came into office, just because I wanted to make sure that I had one for the next 8 years. So that's something we're planning for too, about how different contraceptions, how different just basic services could change under the lens of this administration. The hard thing is, there's so many scenarios, we can't plan for every single one. I can say without a doubt, our team is on it though. Our board, we have been very incrementally planning. What could be the challenges ahead? What are the threats? It's moving on a weekly basis and trying to just make sure that Planned Parenthood here in Oregon is set up to serve as many people as possible, despite what the federal government and this administration throws at us. Yeah.
So do you have a plan on how you can advise us to have influence on the school board to get Planned Parenthood into the schools?
That is a great question. We do have a place about how you can get involved with education opportunities. I do think for folks that have kids in schools, and I'm happy to provide some more follow-up information about like toolkits that we have for talking to your local school, for talking to the school district about advocating that Planned Parenthood can be in and providing these services, because we all know if we can get in before we have a problem, it changes both the trajectory of kids, but also the trajectory of the costs that it puts on our community. So I think I've got a slide to that, and I will follow up with you all about that as well. So we did talk a little bit about Planned Parenthood Action Oregon. So again, Planned Parenthood Columbia Williamette is a 501c3, a 501c4. It's just a slightly different nonprofit under the law, which means that we can do legal advocacy. So PPAO supports both PPCW, so this provider, and that Planned Parenthood of Southern Oregon. They're providing advocacy at the state level. They're helping us talk through things like reimbursement rates, making sure that we're really set up with our legal representatives to kind of manage this climate, and also advocate for our priorities of how can we expand this access and make sure that everybody has access to the care that they need.
The 501c3s are allowed to discuss public issues and still be tax exempt. They cannot endorse individual clients. A 501c4 can endorse individual clients. And in fact, we do that, and those endorsements, I think, have proven very helpful to a number of people who are supporters. So the reason for the existence of the C4, which is a separate entity, as a separate board, is because of that law limiting what we can do, the difference between advocacy focus and actual endorsements of individual laws or individual people running.
And that the league is a 501c3. So and when I was talking in the beginning, we can write letters, we can advocate, but it's always focused on the issue. And we can do a lot that way.
So if you see in Oregon that a candidate is endorsed by Planned Parenthood, it's by PPAO, because that's our sidearm that can do that. So looking ahead into this year, it's been wild already. Quite frankly, I'm slightly shocked that a lot of the scenarios that we've planned for haven't come to fruition. And I would also say we're still very early in this administration, and there's been lots of kind of chaos that can maybe just open the door further for possible issues. But we're leaning really hard into our mission. We have seen nothing but growth. Like Fletcher said earlier, we're seeing people from all 50 states, and specifically that clinic in Ontario is seeing a huge influx in clients from Boise, from Idaho coming in and getting services. We're on track to grow by 20%. That's wild as like a for-profit business model. It's wild as a nonprofit, but again, it's what we're expecting. We're seeing such a high need of folks that are flocking to Oregon, both because they know it's safe and both because they know there's other wraparound resources that we have. A really important thing that when you walk into one of our clinics, we have these things called patient navigators, and they are there to help folks figure out, do you need services here? Do you need a connection to housing? Do you need a connection to domestic violence? What are the other wraparound services that you need? And so when you come here and you come to PPCW, you're really getting more than just clinical care. And although we're facing some really significant challenges, I want to say we're really prepared. I've been in nonprofit management my entire career. I've led boards, I've served on boards. I've never seen a stronger team. I've never seen a stronger team than what PPCW has. And I also would like to say I've never seen a stronger community of people who have come up behind and rallied behind an organization. And want to mention that while it's very strong, it's going to rely on our local communities to ensure that both the word is spread, that those donations are coming locally, and that our clinics are being supported. I was really shocked at the amount of costs that we have to spend in every clinic, from security, like Fletcher was talking about with protests, with our IT security and infrastructure for all of our kind of patient services. And so it's not easy to do this work. Unfortunately, there's a lot of people who don't want us to be doing work. And so while we're strong, we need you all to continue to help advocate for us and to continue to support us. So what can you do? So I think it's so hard because there's so much going on. We kind of feel like we're flailing. Where can we step in? It's so large. We don't even really know where to start. There's a couple of really clear actions as to how you can support Planned Parenthood. Like I said, yes, we get a lot of money through Medicaid. That's a big part of our model, our reimbursement plan, but we cannot do this work without individual fundraising. We have 2 events this year. One is going to be in Portland. I will be driving up there for our signature event. If you know people in Portland, if you can share that event, if you spend time in both communities, that's a great way to join us. However, Fletcher and I are so excited to share that we have one here in Bend. We have one here in Bend. It's scheduled for May 29th, 2025. So pencil that in your calendar. And we're fastly planning it, just because we've gotten so much support here in Bend. And again, Bend, Central Oregon, Eastern Oregon is a community where we need the support in order to provide these services.
So Judy, are you going to that, the annual luncheon?
Yes. So going back, that is that signature event, that Power to Protect is kind of what used to be the annual luncheon. It's in the evening now. You know, as someone, again, who's done fundraising in nonprofits for over 15 years, it's been different since COVID. Lunches have been a lot harder to fill, you know, especially in the Portland area. I would say even here in Central Oregon, having special events and being able to raise the amount of money that's needed for the cost that it takes to put one on, it's been a big challenge. So the team is trying an evening event, but if you had been to our luncheon before, that's essentially what it was.
In Phoenix, I love them, and I don't feel connected at all living in Bend with.
Yep.
At my age.
And there used to be a pretty regular Bend luncheon pre-COVID and pre-downturn in 2009-10. But it did kind of fade, and then COVID pretty well killed it. It never had more than 30 or 40 people. Where our target for this one's 150. I wanted to target at 250, but development offices told me to cool it.
I gotta say, we gotta ramp up, Fletcher. We'll get there. We'll get there.
So, and it's going to be an evening event too. It's going to be at 5:30. We're still working on the details of speakers, and part of the plan is this becomes an annual Bend event, Central Oregon, and to do this, to broaden the base and expand the number of people who are engaged, expand the number of people who know the difference between PPFA and PPCW, and then just continue to get the word about, frankly, about the risks we're facing and the needs we have. And Sarah Kennedy, I know, is going to speak then. We're working on other people who are going to come to the Bend event. We don't have commitments yet, so I got to keep my mouth shut.
However, here, this next slide is actually what I am most excited about and where we've seen some huge momentum here in Bend, and that is hosting a house party. We all know that it costs a lot to live in Bend, right? It costs a lot to go in and host a big fundraiser. This has been a really incredible and intimate way that we're able to bring a smaller group of people. We've seen house parties as small as 10. We had one at Molly Forrester's house, who is not here today, but that had almost like 30, 40.
Yeah, I think we had 40 or 50 people.
In a room, and we were able to generate nearly like $20,000-$30,000 in one night. We bring speakers in for that particular house party. Sarah Kennedy, our CEO, was there. I spoke. We had clients speak. But this is an incredible way to support us. If you have a house and you have a dining room and you have 10 friends, we will come in and help support sharing what Planned Parenthood is all about and raising some money. It's incredible because it costs us very little. And then we're making really clear connections with donors, with advocates who want to kind of be on our side and want to continue to do this work with us.
And then
Yep, and you asked the perfect question early on, how do I give? I can't stress enough how important it is to give locally. Again, there are so many threats that Planned Parenthood could face, and so many that I could talk about, and even more that I'm not allowed to talk about because we're in the middle of legal, things across the country. But PPFA, our federation, our national federation, is really under a tough lawsuit right now. It's all in Texas. I'll let you go and do some research about if you want to see what's going on with that. But the fact of the matter is, if you want to ensure that we have healthcare here in Central Oregon, if you want to ensure that folks have access to all of those services that we showed, you want to get locally to PPCW. And you can go to ppcw.org. It'll share exactly what you're going to. And then I just want to say, as somebody who gets every newsletter, because I get the text from the National Planned Parenthood, the advocacy organization, PPCW, and they're all great messages. And I read them all, and then I go back to PPCW and sign up for my reoccurring monthly donation and know that I'm making my difference and making sure that we have the funds we need to serve the clients who don't have the funds to pay. Yep, you can see how you can donate right there. All the stuff goes to our admin office in Portland. If you see like, oh, a check is going to Portland, I just want to say that's not a bad thing. It means that we're using an infrastructure together where we're able to support the entire state. And you all have had so many questions. I'm sure that there's at least one or two more in the room. Is there anything else that Fletcher and I can speak to or answer today?
Where is Planned Parenthood in Bend?
Son.
Right where they pick it.
It's on Division. Division, maybe 10 blocks north of Shepherd's House.
Division,
Between
Near Denfield Paints.
Across from the car rental place on Division.
Yeah, across from Enterprise Cars.
Road on no street, with no name.
Oh, yep.
Road with no name.
Yep.
And I think they pick it every Thursday.
Yeah. But they, locally, frankly, they pick it. That's their choice. Good. They're civil. They follow the rules. We've not had serious issues. We've also had lots of really good cooperation with the Bend Police Department. They were very helpful on this. And I guess the one other thing, we talked about spending money. We spent a bunch of money over the last couple of years upgrading security at every one of the clinics. Bend is actually last on the list, and we're in the permit process with the city right now. We are going to invest more in that building. One of the reasons it was last on the list was it's a leased building, and there was a change in ownership a couple of years ago. Were we going to be able to stay? Should we look for other ones? We've considered a number of other locations here in town, including getting closer to OSU Cascades. But from a cost and effectiveness standpoint, we think we want to stay where we are, and it's worth investing in it, and we do need the security. We also, I don't think it's a big deal secret, the Ontario building is leased, but it's for sale, and we're probably going to buy it. And just because it's not perfect, there are some things but we don't want to risk a different landlord. And we put in, when we bought it or when we leased it, we put in way more money on leasehold improvements than the cost of the building. So let's make it as good as we can.
Yeah, in the back, I saw your hand first.
Do you have questions? We do a lot of forums for candidates, especially the school board candidates also. Do you have questions that you can send to the league?
Yeah, I can absolutely find that
Send
out.
them to Carol.
Yeah.
So school districts and questions too. Perfect. Okay.
For the candidates, yeah.
I feel like I'm asking too many questions.
No.
I'm curious, how do you, what do you do for people low income, especially from another state, or that come either to Bend or Ontario for housing or food or whatever?
We cannot directly pay people to come for services. There are organizations, there's a Northwest Abortion Advocate organization that does that. But as a healthcare provider, particularly with Medicaid rules, we cannot directly pay somebody.
Yeah.
We coordinate with them, and that's the patient navigator job that Cassie mentioned is new in the last 3 or 4 years, 2 or 3 years. And that's a lot of what the navigators do. They take the calls, okay, what do you need and how can we get it to you? It's interesting. I got particularly right after the Dobbs decision that killed Roe versus Wade, I got a number of people calling and saying, gee, I'll take care of somebody in my house and I can be a host and wouldn't that be wonderful? And Udall at the time said, first, let's see what happens. The flow of people coming in has increased. It didn't immediately. But the second part is it's very clear that most of these patients, even though we want to provide loving care, most of them want anonymity. They don't want somebody coming and saying, meeting you at the airport and saying how nice I'll be to you and everything else. They want to do this themselves and move on. And that's where the patient navigator job comes in. That's professional and it provides them with the anonymity that they, in most cases, want.
Thank you.
Yes, ma'am.
Well, two things actually, quickly. Would you say, this is just, I understand that, like Oregon is part of the Reproductive Underground Railroad?
I mean, we're definitely the hot spot as to where to get reproductive care because again,
It's
it's
like secret, I mean, yeah. But what I really want to ask is, in the old days, I remember like when they had those huge picket crowds and the horrible signs with awful pictures on them. And you had volunteers, I think, to help the women, get from their car
Yeah.
to. Is that necessary
that is
anymore?
still a volunteer position that we have today. If you go to ppcw.org, you click on volunteer opportunities, it'll give you a whole list. I can share when I went in. Actually, I think I was just going to drop off cupcakes for the staff. Same thing, there was a volunteer that day. It's essentially an escort, somebody that helps escort the folks inside from their cars to make sure that they're safe. So that is still a position that we offer. I do want to say, if you can imagine, we are getting a massive influx in volunteer requests. And we are not actively growing our volunteer team because if we have to choose at this time where we're dedicating our resources, it's really pretty client-centric. So if you go and you fill out that you want to be a volunteer, like give them some time because they've got a lot. But yes, that is still a position and a role that we need. Did I see what? Yes, ma'am.
I was just wondering, Fletcher, you said the building on Division is leased.
Yes.
Is there any movement to try to buy a place in Bend rather than?
We talked about it quite extensively when we re-upped the lease a few years ago. We have a very positive relationship with the landlord now. And we couldn't find a really cost-effective, good, better space. Real estate here is crazy expensive, so.
It's on the bus
so-
route.
It is. It's on the bus route. There's lots of other services right in that complex too. And again, if we had a big priority list, I would say us owning a facility in Bend is pretty low. We're still disaster planning for what 2025 has ahead. But it's a beautiful clinic. And again, anybody can be served there, including women that have insurance like myself.
It is interesting for an old white guy to show up there. Before they figure out who I am, they're pretty cautious.
The counter protester is generally a man. So
Right,
you have the
right.
protesters on one side and then you have the man on the other side. So you wave to him and you don't do anything with your other hand.
Good. We need more men. So we need
That's
more
right.
men.
That's right.
Well, I want to thank you all from the bottom of my heart. I always like with ending that I shared that I was a Planned Parenthood patient as a teenager. I'm a Planned Parenthood patient today, but I also like to share that I am the recipient of a life-saving abortion. One for a pregnancy that I desperately wanted. My husband and I were trying for years, and I had a miscarriage that quite frankly, if I was living in Texas or many other states, that could have killed me. And I think it's important to know that Planned Parenthood impacts so many people. It is life-saving services. It is daily care services. It is education. And so please continue to stand by us. Please continue to advocate for us, and please continue to support us. We really appreciate it.
I was going to encourage you all to donate because they didn't ask for a per diem, but